This video is produced as a training tool for doctors and nurses and other healthcare professionals. It explains the code stroke scenario which we use in our institution for the rapid assessment of patients with suspected stroke to enable timely administration of thrombolysis wherever required. The community needs to know how to recognize stroke. Spread the word of fast. F is for face. Ask the patient to show their teeth or smile and observe if the face droops to one side. A is for arms. Ask the patient to stretch his arms and observe if one arm drifts downward. S is for speech. Assess the patient's speech for lack of clarity or slurring. T is for time. Time to contact the nearest healthcare center. As soon as a patient with suspected stroke reaches the emergency department of the hospital, the emergency medical officer quickly assesses the patient and activates code stroke.
Attention please, code stroke activated in emergency.
The time of onset of symptoms should be noted immediately. The code stroke activation instantly notifies the entire stroke team, including the stroke physician on call, the stroke physician assistant, stroke nurse, and the radiology doctor on call. The on-call stroke team reaches the emergency at the earliest, and a detailed neurological assessment is done. The time of onset of symptoms is reconfirmed while simultaneously assessing for comorbid conditions, drug history, and any contraindications for thrombolysis. The patient is quickly shifted from the emergency to the CT scanner for imaging, and the CT images are rapidly read by the on-call stroke physician and radiologist. Once the CT confirms an absence of intracranial hemorrhage, a decision for thrombolysis is taken after taking an informed consent from the relatives. After this, the patient receives the recombinant tissue plasminogen activator. The code stroke protocol ensures rapid assessment of stroke patients within reduced times, thereby decreasing the door to needle time.